Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Oshner Sherren regimen. So what is the principle of this regimen? So the principle is the inflammatory process is already localized. So we are assuming the inflammatory process when it is localized and that the inadvertent surgery is difficult, and the inadvertent surgery, this becomes very difficult and it may be dangerous as well. So it is difficult as well as dangerous, and it may be impossible to find the appendix. So appendix finding, this is going to be totally difficult or impossible to find, and occasionally a fecal fistula may form. So there can be a fecal fistula, this may form, and there is an antibiotic therapy. It should be given after performing the CCT abdomen as well as the antibiotic therapy. So this antibiotic therapy should be given after the CCT abdomen. So this will be after the CCT of the abdomen. Next is the abscess. If present, it can be drained radiologically. So if it is present, it can be drained radiologically. So what is the outcome of this Oshner Sherren regimen? The outcome is there is an improvement within the 24 to 48 hours. So when you look at 24 to 48 hours, there is a very good outcome. There is an improvement is seen. And in terms of 90%, so 90% cases resolve. So 90% of the cases it resolves. And there is a failure. The failure should raise suspicions of the Crohn's disease. So in terms of failure, it should raise the presence of the Crohn's disease. So it can indicate the presence of the Crohn's disease as well as the presence of the carcinoma. Next is the criteria for stopping the conservative treatment in the appendicular mass. So what will be the criteria to stop the conservative treatment for the appendicular mass? So the appendicular mass. So the criteria to stop is the rising pulse rate. The rising PR, that is the rising pulse rate. Next is the increasing of the spreading abdominal pain. So this increase or the spread of the abdominal pain. Then comes the increase in the size and the mass. The increase in the size as well as the mass. To learn and grow daily like this, please do subscribe.